Austin leaders want the city to do a full-scale review of how multiple departments respond to mental health crisis calls to potentially lessen the role of police.
Now, the effort, which council members will consider at their Thursday meeting, comes in the aftermath of the unprecedented October conviction of Austin police officer Christopher Taylor, who shot and killed a man holding a knife during a mental health episode.
Senior reporter Tony Plahetsky joins us here in the studio with more on this. Hi, Tony.
Hey, Brian and Quita. At the core of this effort, city officials want to know if there is a way to put more mental health calls in the hands of counselors and social workers, taking them out of the hands of police.
We, the jury, find the defendant, Christopher Taylor, guilty of the offense of deadly conduct.
3 months after the conviction of APD officer Christopher Taylor in the shooting death of Morris Da Silva, a man with a knife suffering a mental health episode, Austin officials want to prevent future similar tragedies.
What the Christopher Taylor case did was highlight the issue for the entire community.
Austin City Council member Chito Vela is proposing this resolution. It would instruct city staff to analyze data and trends related to the number of mental health calls the city receives to 911 and 311. The number of police hours spent on those calls in 2022, 2023, and 2024, and the number of 911 calls diverted to a mental health call center each year. The proposed resolution said that the use of the Austin Police Department as the default response for multiple social issues can complicate the focus of its core mission of law enforcement and lead to serious unintended consequences for those in mental health crisis and the community at large.
When we send law enforcement to respond to mental health calls, to people in mental health crisis, we get negative outcomes. And the Officer Taylor case is really kind of the primary example.
The effort comes amid a national conversation about how and when police should respond to mental health calls to make them safer for both citizens and police. Shannon Scully, Director of Policy Initiatives for the National Alliance on Mental Illness, said research and on-the-ground experience has found that mobile crisis teams made up of counselors and special trained paramedics are often more effective in getting people to mental health services.
Law enforcement, for better or for worse, have been the primary responders to mental health crises in this country. And I think if you talk to a lot of law enforcement leaders like I do, is a lot of them know that they don't belong.
For a decade, Austin has partnered with Integral Care to have mental health teams respond to certain calls. But those teams are not on duty 24/7. And APD still responds to about 8,000 mental health calls a year. Vela said part of the goal of the resolution is to examine whether it's more appropriate and safer to shift more calls to crisis response teams rather than police. Officials may have to hire more counselors to expand that effort. Vela said if the city can eventually shift the majority of mental health calls to non-police agencies,
I will consider that just a huge policy victory.
Now, if the City Council passes the resolution to do this review, Councilmember Vela says he hopes it is completed in the next few months in time for next year's budget that will be drafted over the summer. Brian and Quita.
Tony, there's also a proposal at the state level that could task other agencies with responding to these mental health calls as well.
That's exactly right. We told you several weeks ago that State Representative Donna Howard has filed a measure that would expand the authority for mental health emergency detentions to EMS paramedics statewide in addition to just police. And Brian and Quita, I also want to point out that the local police union is supportive of both Representative Howard's measure as well as this proposed resolution that the Austin City Council is proposing. So a rare meeting of the minds between the police union and the city council. It does not happen very often.